Are we okay to start then?
Yeah, let's go ahead.
Okay, perfect. So I apologize in advance for the kind of extra sciencey articles. But with the practice I've started in, we've seen a ton of FIC cats and a ton of black cats. And so it's a little bit of a wormhole that I've been going through recently. Um, so just wanted to start out kind of giving a summary of what we're going to talk about. We'll start with kind of a combined introduction from both of the papers, and then we'll go into what I'm calling paper number one, which is the one that talks a bit about the urinary biome in FIC, and then paper number two that talks about kind of a novel nutraceutical in cystitis. And then we'll kind of wrap things up with what we can potentially do with this super sciencey or kind of lab bench type data, and then go from there. So again, as we go into our introduction, we'll talk a little bit kind of about FIC in general. And I think timing wise, coincidentally, this matches up at least a bit with what we'll be talking about in core curriculum. So one of the cool things that I think about FIC is that it is really, really similar to the clinical, or both clinically and histologically, to interstitial cystitis, or what's called bladder pain syndrome, which is seen in humans and primarily in women. And so it does create kind of a unique opportunity for research funding and an opportunity for using some more novel therapeutic interventions that would maybe be gained or used more at humans. And I think whenever we have the opportunity to do that, it's kind of a cool thing. So feline idiopathic interstitial or idiopathic cystitis, like I said, as the name implies, is a syndrome. So we basically don't know exactly how or why it happens, but we know it exists, and we know that there's a myriad of predictable clinical signs and histopathologic changes. So both diseases are characterized by lower urinary tract symptoms, including plaquuria and dysuria. And then histologically, there's an appreciation of an increase in mast cells, leukocyte invasion, bladder wall vascularization, and an impaired urothelium barrier function. Oxidative damage to the urothelium is suspected to be present, but it's poorly investigated. And there has been some evidence that antioxidant therapy can potentially be protective towards recurrent episodes of chronic cystitis, but there really isn't any definitive information about that. More recently, a model for interstitial cystitis or bladder pain syndrome has been elucidated through a cyclophosphamide-induced chronic cystitis, and they found that both clinically and histopathologically, these line up really, really nicely to the bladder pain syndrome. But really, if we're kind of considering these to all be a very similar syndrome, including FIC, it also lines up to our FIC patients. And as we all know, kind of treatment goals have been primarily aimed, and this is both on the human side and on the veterinary side, have been aimed at providing pain control during an acute episode, which often includes oral analgesics, anti-inflammatories, with a goal, a kind of additional hopeful goal of increasing disease-free days. Unfortunately, both on the human and the veterinary side, we haven't really found anything that's extremely useful or validated with that. And in general, I think there's a push for dietary intervention, at least for the feline side of things, of prescription diets and environmental enrichment to try and give us more disease-free days. And as we gain a better understanding of chronic pain syndromes in general, where it has kind of allowed for us to have a more novel investigation for treatment of clinical signs and maybe increasing our disease-free days. So as we're kind of talking about chronic pain, it brings us a bit to the ALEA mechanism. And this is something I had not been super familiar with. And so the ALEA mechanism is a kind of mechanism that was proposed by someone who actually won a Nobel Prize for it. And she found that a group of naturally occurring lipids are proposed to down-modulate hyperactive immune inflammatory cells with a specific focus on mast cells. And so PEA, or palmitoyl ethanolamide, and I'm not going to go by the long names of any of these, but that's a parent molecule of the ileal mechanism in general, and it's shown to help with dysuria and pollakiuria in humans with interstitial cystitis. PGA, which is palmitoyl-glucosamine, is another member of the ileal mechanism of glycolipids, which has been studied which has not been studied for its evaluation of kind of chronic pain or chronic cystitis or interstitial cystitis, but it is an approved animal feed additive in Europe. And so our second study will talk a little bit more about that, but I wanted to at least give everybody kind of an overarching idea of what the ileal mechanism is, and kind of some of the things that it's doing in terms of inflammation and analgesia, and kind of what's been appreciated with it. So it is a pretty cool pathway, a pretty cool mechanism to antagonize a hyperactive immune system. So has the potential to be really, really helpful in a lot of our chronic pain diseases. So the other kind of side of things that we're going to discuss with FIC is a bit more of another, I should say, newer topic, which is microbial diversity in general. So in humans, there's a handful and a half, maybe a little bit more than a handful and a half of urinary microbial studies that have allowed us to maybe elucidate the idea of, is urine sterile? So next generation sequencing has allowed us to detect microbiomes in urine and show that maybe these patients aren't as sterile as we historically have thought. So in humans, the urinary microbial diversities have been shown to trend based on sex, age, and clinical status, including the presence of interstitial cystitis or bladder pain syndrome. Some studies have demonstrated a link between bacterial diversities and clinical disease, while others have demonstrated no association. So kind of as we're starting to get into this idea of the microbiome, I think of the entire body, there's conflicting data regarding that, and it's definitely still a very active area of research. So then we look a little bit at kind of urinary microbial diversity in cats, and there are definitely less studies. To my awareness, there's 3. And both Lund and A.Balboni showed no evidence of a bacterial community that was appreciated, unlike what was found in human literature. And then Kim et al. Did find that there was a biome, and maybe there were differences appreciated in cats with kidney disease, but still a little bit kind of non-specific whether there really is a true microbiome in the urinary bladder, and if that is significant, and kind of where we're getting those bugs. So this kind of leads us into our first paper. And so this paper, and both of my papers, are actually out of Italy. So we're taking a trip across the pond today. So this was a prospective study from the Veterinary Medical Hospital of the University of Bologna. And so since the role of urinary microbiome in the pathogenesis of bladder pain syndrome in humans is pretty debated, and the presence of viable bacteria in urine specimens of cats affected by FIC has not been demonstrated, the overarching aim of this study was to figure out if there is a presence of bacterial community in the urinary bladder of cats with FIC, and are these potentially viable, or are we getting kind of chunks of bacteria from other areas? Because that's one of the challenges with the NGS sequencing is it doesn't necessarily represent live or viable bacteria. And so this study used both culture-dependent and culture-independent methods, and the culture-independent methods being that next generation sequencing. So materials and methods for this study, they used 19 client-owned cats that received owner consent, got basic signalment history, clinical signs, and then they were chosen to be FIC based on a more recent paper looking at risk factors, pathophysiology, biomarkers, management of FIC. And so ultimately, if an exact causation was not found, then it could be considered to have FIC, and that's how they diagnosed these cats. So if they had evidence of a urinary tract infection using conventional culture methods, they were not enrolled. If they had evidence of stones, they were not enrolled. If they had evidence of bladder neoplasia, anything along those lines, they were not enrolled. So no underlying cause for their urinary symptoms were considered to be part of that FIC group. So all of the urine was then collected by cystocentesis, and the urine was evaluated for bacteria using culture-dependent methods. And so again, as we're getting here, they've already had a negative urine culture using standard techniques. So then they used an expanded quantitative urine culture, which is our culture dependent process. And just to kind of talk a bit about that, expanded quantitative urine culture is an enhanced culture protocol for the detection of viable microbes in urine specimens. So it uses a bit of a larger volume of urine and different sets of culture conditions. And it's been found to be able to uncover a wide range of bacteria and yeasts that were otherwise undetected by standard urine culture. And it's actually quite helpful with some of those, I'm going to call it more difficult to culture urines, whether it's because of dilution or other things going on. And then in addition to general common urinary pathogens, the extended quantitative urine culture has been shown to detect emerging and new pathogens and even some commensal microbiota. So the urine was then also evaluated using the 16S RNA next generation sequencing. And since both of these tests are incredibly sensitive, they also used a skin swab obtained from the abdomen of the cat at the time of cystocentesis, after the kind of abdomen has been scrubbed, to see if they could PCR any skin contaminants, so that if they were seeing those same things, they would know this is most likely contamination and not actually something relative or relevant that they've grown. And so this kind of timeline here discusses or gives an idea of what the thought processes were, the timing of the UA, how much was pulled, and then the various testing that was done. So now we get a little bit into the results. It was a pretty good mixed population of cats. Unsurprisingly, probably to any of us, the majority were male, but I liked that they included some females in the population, since FIC can happen in both sexes. There was no evidence of bacterial growth from the skin swabs, which I think was really interesting. And it's important. I think a lot of us always debate, are we potentially going to expose, like we think cystocentesis is perfect, but are we sometimes grabbing skin contaminants that could muddy the water when we get a positive culture? And it sounds like, no, we're actually pretty good at doing sterile cystocentesis, and we can probably trust those results. I think that's obviously not the point of this study, but I think a helpful thing, just as a reminder that we do okay with what we do. So then, as we went through, the extended quantitative urinary cultures actually had no bacterial growth across the board. And so what that indicates is that there's no viable bacteria that are appreciated in these, even when we're kind of looking more sensitively at the kind of idea of a microbiome. And then the parts that came back positive with the next generation sequencing were actually lower than is considered to be the limit of detection. And many of the indices were consistent with, I'm going to call it bacterial pieces of what would maybe be normal in the world. And so really nothing massively significant. Interestingly though, because next generation sequencing is so sensitive, you really do still end up getting evidence of some sort of bacteria. And so just as a reminder, for those who are less familiar with this process, which I know definitely was me before reading about this, the idea is we're taking a sample, in this case urine, it's then getting spun down, we're trying to extract DNA, and then we're running PCR on those kind of known bacterial points, and then creating a DNA library and then allowing us for DNA sequencing of that bacteria. And so it is, just like when we're using PCR, incredibly sensitive, and even minute portions of the bacteria are getting included or picked up as part of that library construction. So the conclusion with this study, it's reporting that there's no evidence of viable microbial community or of any bacterial DNA of urinary origin. So this suggests that the urinary bladder of cats with FIC is in fact sterile. Um, the absence of a significant bacterial community in the 19 cats affected by FAC added to kind of the other 10 healthy cats from a previous study run similarly, Lund et al., contributes even more to the fact that these FIC cats seem to have sterile bladders. I think one of the limitations and one of the questions that I had as I was going through this is this normal? So is it abnormal in these FIC cats that they're not having any evidence of a urinary microbiome? And is it perhaps the case that normal cats maybe have a better urinary microbiome, and the reason that these FIC cats are having issues is because they're lacking that? I don't know the answer to that. I think that was one of if we had a control associated with this study, that would have been maybe a little bit more helpful to try and elucidate that. But one thing that it definitely did show is that these methodologies to collect both a culture dependent and culture independent analysis can be done, can be useful. And comparing that to what they're calling a negative control sample, which is like a clean sample with the NGS sequencing is important because it gives you an idea of kind of just the general background of bacterial pieces that live in the environment. So I think it's an interesting study. Is it going to change the way that we maybe manage these cats? No, probably not. I don't think, most people aren't using antibiotics at this point. But it is an interesting study, an interesting idea, and it does beg a little bit of the question is, maybe this means that there's a problem with their microbiome, or potentially our cats different than humans, and that's always obviously a very real thing. And I think nobody would disagree that they're different. So now we'll kind of go right into this other study. And so this is my even more sciencey study, but I actually think is a little bit more interesting. And so this study, which is out of Italy, but this is the University of Messina, with some combined efforts at St. Louis University School of Medicine. And this is a rodent modeled study aimed to investigate whether a dietary supplementation with PGA HSP, and that PGA, remember, is part of that ALEA mechanism glycolipid, can afford protection against development of an induced chronic cystitis. And so this study used the cyclophosphamide-induced model of creating a chronic cystitis. And then the other thing that they looked at was, is there any additional effect to neuroinflammatory changes at the level of the spinal cord or the CNS? So materials and methods for this study. So this study was performed on 7-week-old Sprague Dolly rats, which are, I think, pretty standard white lab rats. And they were degraded or put into 5 different groups. So there was a control, and those are just healthy, normal, like a placebo rat group. They were not treated with the cyclophosphamide, but they went through with the rest of the experience. The second group were the cyclophosphamide animals. So they were treated with an infusion of that, and they weren't given any additional medications. There was then I'm going to call it CYP because it's easier, but a CYP plus MESNA group. And MESNA is a compound that counteracts the toxic effects of cyclophosphamide. So it was kind of acting as a positive control. And then the other 2 groups were a CYP group with a low dose of the PGA HSP, and then a CYP group with a high dose PGA HSP. So it was, everything was the same as the low dose group, except they doubled the dose of the nutraceutical. And the way that they ensured that the rats were getting that is they did oral gavage in order for them to ensure that they were getting the correct amount of that nutraceutical. And so the study was performed over a total of 10 days, where day 0 was the start of induction of cystitis or the first infusion of cyclophosphamide, and anybody, the kind of control, they were still getting an infusion. It was just of saline, and so causing less trauma, but still having the same overall experience as the other rats. And so then they had repeated injections at day 3 and day 6. And again, this is a protocol that's been elucidated previously to really mimic interstitial cystitis or the bladder pain syndrome. And so therefore also, I'm going to call it, it mimics FIC. So then at day -3, they started them on the supplement. So that was 3 days before they started the infusions. And then they evaluated for visceral pain using what's called a von Frey test. And so basically they cause discomfort in the region of their bladder and their lower abdomen. And if they have visceral pain at varying levels, it kind of adjusts and indicates that. And that von Frey test is something that has been validated and is commonly used in rats to assess for visceral pain. And then on day 10, there was an ultrasound that was performed, and then the rats were all euthanized and kind of everything was collected and tested from there. So again, like I mentioned, on day 10, an ultrasound was performed under light sedation. And the reason for that is it's a minimally invasive way of evaluating things, which absolutely could have useful is a useful modality that could be used on feline and human patients down the road in comparison. Then they did a gross observation of the tissue after removing the urinary bladder. They did histopathologic evaluation of the urinary bladder. They evaluated for oxidative stress. They evaluated for presence of tight junctions. And so they did that by looking at the expression of the transmembrane barrier proteins, claudin-1 and occludin. And they also did measurements of histamine and serotonin levels of the bladder tissue. Along with some of the histopathology, they were able to see the presence of mast cells. And then the last thing they did was do kind of general RT PCR for looking at inflammatory gene expression. So to kind of get an idea of differences in inflammation in the tissue. Now, as we get onto the results, and again, what I think is kind of exciting and the good stuff of this paper, we'll kind of go through their various findings. So they first evaluated the differences in visceral pain tolerance. And so this is these graphs up here. And what this is giving us an idea of, so the black marker is going to be the CYP. So that's the positive control without anything counteracted. And they're showing it on day 0, 7, and 10. And so the more mechanical threshold that is put on to the rats without a reaction indicates less visceral pain. So it's a little bit weird to think about that. But so you can appreciate at both day 7 and at day 10, we see that the CYP rats that did not have anything protecting had the lowest threshold for pain, so meaning the most visceral pain, and that actually the high dose PGA rats acted very similar to the mesna, which is something that prevents the toxicity of the cyclophosphamide. So at that high dose, we are seeing a good reaction from that. And then the other thing just to note is we have our control here, which is the white box. And so you see that those rats are happy. They're not having any sort of abnormal pain sensation. So then moving down, evaluating the ultrasound, it was a similar finding as appreciated with a significant reversal of the irregular bladder wall and thickened bladder wall in those rats that were either treated with the mesna or that had the higher doses of the PGA and HSP. And so I acknowledge that these are not the most beautiful images and that rats are tiny, but you can definitely appreciate on the CYP-induced ones, this is a thickened urinary bladder. You can see these little kind of protrusions indicating inflammation, irritation, maybe some polyps, hard to say, versus our control, which is like a nice, thin, normal-looking urinary bladder. And then really the mesna and the high dose, very similar thin effect to the urinary bladder. So indicating that there was either a prevention or an improvement of that. So continuing on, and I'm going to do a little bit more on pictures because I think they're more fun to look at. But up top, we have the gross images. We have our controls, which looks like a healthy urinary bladder. You have the cyclophosphamide-induced cystitis. We have lots of blood vessels. Grossly, these look gross. They look inflamed. They look painful. They look, there's a lot of blood vessels present. The MESNA treated, we see that there's definitely an increase in inflammation, but much better than the SIP straight. And then when we look at the low dose and the high dose, we similarly see on this low dose, there's more vessels, there's more inflammation versus the high dose where really it looks almost like normal bladder tissue. So again, continuing to show that this supplement does seem to help. And then on histopathology, similarly, they appreciated the expected changes to the bladder with the SIP injection, including inflammation, vascular congestion, microhemorrhages, extensive submucosal edema, when compared to the controls. And then according to both inflammatory severity scores and looking at the collagen deposition, that high dose PGA-HSP patients, or not patients, but rats, had an improvement overall. So acted similarly to the MESNA, was the higher dose, and reverted ultimately the collagen deposition and reduced fibrosis. Hang on one second. Sorry about that. I knew somebody was going to come and interrupt at some point. I have a patient getting a kidney aspirate. Okay, so back to these images. Like I said, the kind of cool thing of this is that the MESNA and the PGA-HSP seem to be acting similarly versus like our low dose and our control. We're seeing tons of inflammation, tons of fibrosis accordingly. And they created like an inflammatory scoring system to try and be a little bit more objective through this process. So then getting into a little bit more of the nitty gritty, evaluating for inflammatory gene expression, the bladder mRNA expression levels of inflammatory cytokines, interleukin 1B, TNF alpha, IL-6, CCL2 was significantly increased in the SIP group in compared to the controls. And then the high dose PGA and the MESNA demonstrated a significant downregulation of the gene expression of those cytokines. And again, those same results were seen with the MESTA group. Again, looking at bladder mast cells. And so the little yellow circles here are demonstrating mast cells within the bladder wall tissue. And so, and obviously this is a small snippet and they're going to make it look better, but overall looking at it, there was a significant decrease in the number of mast cells. And additionally, they used staining that would demonstrate if it was a degranulation of the mast cells. And they found that there was not only a decreased mucosal mast cell density, but there also was a decrease in degranulation events of the mast cells. And at least on the human side, it is known that mast cells are thought to be a big player in causing the clinical signs associated with interstitial cystitis and bladder pain syndrome, which is one of the reasons they wanted to look so much at that. And the similar findings were found with histamine and serotonin, respectively.
It's done first.
No.
Okay.
Were done respectively. Looking at the urothelial barrier, the cyclophosphamide injected rats had a reduced bladder expression of claudin 1 and occludin, indicating that they had weaker or poorer urothelial barrier function. And they found that expression was increased, or they're calling it restored, same idea, in the rats with MESNA and those treated with the higher doses. And then the other interesting part of the study where they were looking at, is there an alteration at the level of CNS expression? And they did find that the number of mast cells in the spinal cord with the cyclophosphamide injection group was increased in comparison to the control. And then that density was significantly reduced in those who received MESNA and the higher dose of the PGA-HSP. So to kind of go into the conclusions and limitations of the study, I think an important and the biggest limitation is this is in rats, and rats are not cats and rats are not humans, but they're at least trying to use a model that has been pretty well validated. Another kind of limitation is this product that they're using is a PGA HSP combination. It was a mixture of a 3-to-1 mixture of those two components. And HSP has been previously thought to be helpful in the clinical signs of these diseases. And so is it the PGA that's being really helpful? Is it the HSP? Is it the combination together? And that's a little bit of an unknown. To be honest, like for me reading this study, I don't know if I care if this kind of combination seems to work so well. How much do I care that it's one versus the other, if it's getting such promising results? But definitely does deserve kind of further investigation. And the other is the PGA, and one of the reasons that they use this is that it has glucosamine in it, and we know that glucosamine can be beneficial towards having a good, nice urothelial barrier. And so what happens with that glucosamine is that somewhat why we're getting some of that effect. So I think overall we can all agree that this study showed, at least in rats with induced cystitis, that this triad of inflammation, oxidative stress, and fibrosis was pretty effectively mitigated by the PGA HSP supplementation at a higher dose. This specific 3-to-1 mixture of the PGA and HSP significantly counteracted the multiple pathologic changes occurring in this cyclophosphamide-induced chronic cystitis, and the decrease of inflammatory mediators as well. It definitely included at the spinal level, and the protection of the urothelial barrier and the pain relieving effect can definitely be of clinical relevance to our FIC patients. I think bioavailability of these substances in cats is something that obviously would need to get figured out, but if this is really something that is basically like a feed additive, it could have really, really big implications in our patients. So kind of take homes and applications to our patients. I think antibiotics continue to not really be indicated in our true FIC patients. That's something that we knew. I think the other kind of take home along with that is, are there some urobiome diversity or changes in our FIC patients indicated by this lack of growth? And that's definitely something that to kind of keep in mind. The other is that nutraceuticals can be a useful and effective method of controlling signs of FIC. And I'm sure everybody's clients are very similar, but that's something that the general public would probably be really excited about if we can get a little bit more specific data. So just to kind of go into a little bit of future directions, I think it'd be great if we could have some studies looking at PGA HSP in cats, and especially in cats that are affected by FIC. And then the other directions would be, do cats have a urinary biome has been appreciated in humans? And does this kind of, I'm going to call it a lack of a biome that's been appreciated in a couple of these FIC studies, is that indicative that maybe there's a problem there? So that kind of wraps up what I wanted to focus on with these studies, and wanted to see if anybody had additional thoughts, questions about this, or if everybody kind of wants to kill me for talking about rat models and not going too much into something super clinically relevant. I'm gonna take that as no questions. Is anybody, like, just out of curiosity, is anybody doing research or looking at using any of these like ALEA mechanism molecules um, in their labs, whether with rats or with cats? Or has anybody heard of it? Maybe not.
Joanna, how's it going?
Oh, hi.
Hey, I just feel like FIC is just a really tough disease. I feel like I get cats sent to me all the time that are quote unquote FIC, but they really have sediment that's building up in their bladder and just really haven't, been effectively worked up.
Mhm.
I just find FIC is just a very rare disease. And ultimately, there are cases where, sure, that could be the underlying cause, but I struggle to actually definitively call them FIC.
I think that as a group, we're probably not great at um, ruling out or eliminating all of the causative signs. I think that's probably what you're getting at, and that there's quite a bit more to it. Yeah, I think it looks like Dr. Lulich commented that they didn't do a great job of defining, at least in the bacteria study, if the cats were non-obstructed or obstructed, or kind of what their presentation was. And I did think that was, I don't disagree with you. I think one of the things they even commented that if cats had urinary signs within 3 months, that was like urine that could have been included. And so they may have not actually been having an active crisis at the time that their urine was collected. We'll see. But thanks everybody for joining. If nobody has any other questions or comments, and I hope everybody has a good break. I think am I the last person of the new year?
Of this year, yeah, yeah, we will
Perfect.
resume in January. So
Perfect.
thank you so much. I don't have a comment related to the article, but your black lab is adorable with the
Thank you.
dinosaur.
He's a monster. Awesome. Well, thanks everybody.
All right, take care. Bye-bye.
You too. Bye bye.